Lamotrigine, or Lamictal as it's sometimes called, is a drug that is primarily initially created to help try and treat or control seizures. However, more recently it seems to be more often prescribed for bipolar and similar conditions. So it has changed according to what it seems to help with. It does affect a lot of the body's systems, and that's why I want to talk about it today, because I have been on this drug. If you've watched my other videos, you know that I was initially started on Keppra for occasional seizures, and that went horribly. And so when I left that one behind, I stopped taking anything for a while, and eventually I did have a couple more seizures, much lighter but still very problematic, and so I was ultimately coerced to start taking Lamotrigine, which has caused so many problems. That was back in October of 2022, and I'm still on it, and I'm trying to wean my way off of it, which is extremely difficult. And I want to just share some things that I'm dealing with and things that I have learned about it, because I know far more about this drug than I ever wanted to have to know. So it has a ton of side effects, of course, and it's actually why it's not usually considered the first line of defense against seizures. It's often one that comes later on. So sometimes it is. But also I've noticed that from people I've spoken with, people that I've read online, their stories, that Lamotrigine often isn't, if you're using it for seizures, it's not the only thing you're using, because in itself is not enough of a drug to help to control the seizures. So it seems to be something that probably really shouldn't be on the market, like many drugs. And some people do find it useful for them, for their bipolar or for their seizures, and that's great if they don't have many side effects, but probably they have at least some of them, because this is not a drug that has no side effects or rarely has any side effects. So the one side effect that doctors do generally warn their patients about is Stevens-Johnson syndrome, which is a horrific rash you can get from this drug, and it can kill you. It's a really scary rash. It's a horrible thing that affects not just your skin, but can actually attack your internal organs as well. So if you get it, you're supposed to go straight to the ER. So thankfully I have not had that one, but it was one to kind of be aware of. And Lamotrigine, I'll just say as a side note here, that it also can cause a lot of other skin problems, including acne, which I have experienced. So whenever you have all these other rashes and things going on, you're always looking and saying, is it Stevens-Johnson or not? And hopefully it's not. But that is not the most common side effect. However, there are lots of other very serious side effects that doctors should be warning people about. So I'm going to talk about some of the ones that I have experienced. So the first one that I would say is fatigue. Every single anti-seizure drug out there does cause fatigue. That is just how it is. So if you have a lot of seizures and the only thing you can do is take drugs for it, you're going to have a lot of fatigue all the time. That's just how it is. Some people more so, some people less so. Now for me, because I have MS, I already have fatigue. So for me, this was doubling my fatigue. And that made it extremely difficult, and makes it right now even very difficult for me to function at all, to get out of the house, to do anything. So that is, it's a very severe thing. People don't realize fatigue is actually a disability, and it really is. It destroys all of your life, everything you want to do. As a result of fatigue, what you often get is what they call cog fog or brain fog. So your brain is just fuzzy. You can't think of things you need to think of. You can't focus very long. You can't make decisions. And also, in addition to that, a very common side effect, I think really kind of related to the fatigue, is memory problems. So a lot of people on this drug, their memory just kind of goes to pot. And I found that my memory has been horrific. And there's also another related side effect, which is called aphasia, which means that you can't find words. And I definitely have that. Everybody gets that to some degree, especially as we get older, but it gets quite dramatically worse on Lamotrigine, to a point where the memory loss and everything going on can actually cause people to be diagnosed with like an early onset Alzheimer's or dementia, which hopefully is reversible when you quit the drug, but I don't know, maybe not, because sometimes this drug really does things to your system that won't change afterwards. It's very severe, and it's really sad to me that neurologists, doctors, psychiatrists don't tell you about all of these problems you could be facing. So it also affects hormones, and the most obvious thing that people talk about is an increase or decrease in libido, but there are other things that it can affect. And it can affect everything to do with if you want to have babies or your cycle, all those sorts of things. And especially when you have seizures, then for a lot of women, the cycle is a factor in how many seizures you're going to have. So people sometimes have just seizures once a month because of the cycle. So that, I think, is also an issue. And we already have so many things affecting our hormones in the Western world that this is something we really, really need to be aware of. It is a factor. Another very common side effect is vivid dreams, and I definitely experience this. I'm the kind of person who doesn't sleep very well, and when I do, it's very light, so I have a lot of dreams anyway. But wow, vivid dreams, like they're so detailed and they're so intense that you remember them all day, the next day, and even for days to come. And yeah, they're very, very intense, so it affects you. It affects your mood. It affects how you sleep. It's an uncomfortable sleep for me. Some people like it because it doesn't really give you nightmares necessarily. However, when you do have bad dreams, they are full-on nightmares because it is so intense all the time. It's really strong colors, really strong events, details that you can recite afterwards, just ongoing crazy things. So if you really want vivid dreams, you might like this drug, but for people like me, no thank you. I'd like to just sleep and get some rest. Bruxism is another major issue with a lot of people using Lamotrigine, and that is when you grind your teeth or clench. And it's not just a nighttime problem with this drug. It happens all day and all night. And that, of course, causes a lot of jaw pain. And for me, already I have some issues with my jaw, so it increases my lockjaw, it increases muscle problems, it increases pain all the way through, and especially down in here. And it also messes with your teeth and your gums. And so you get a lot of gum recession, which I have had some. I know some people have had it so bad that they've actually lost teeth over this. So I'll bet you not too many doctors are telling you could lose your teeth when you take this drug, but it could happen. Another problem related to it possibly is the lesions that can form inside your mouth. And I have had that as well. And it's painful and frustrating. Personally, I recommend when you have those sorts of things, all of it, anything that's bothering you in that way, do lots of rinsing with salt water. It does help to settle it down some. Doesn't make it go away though. Another problem that this drug causes for your system, and this is probably true for most, if not all, anti-seizure medications, is that it depletes you of vital nutrients in your body. So things like vitamin B6, and I'm sure a variety of other vitamins, other B vitamins especially. So if you're stuck on this drug, you really have to be focused on your nutrients and getting those tested if you can, and make sure you increase them. Now, I did learn that about Keppra, that B6 gets heavily depleted, so I started taking high doses of B6, which did have some effect. It did help some. And yet, I don't think any doctor recommends you take B6 when you're on any of these drugs, but you should. And of course, get your levels tested to make sure you're not taking too much or that you're not overcompensating. But it is a big deal. And things like calcium depletion, magnesium depletion are all a part of this. And so you've got to be taking your magnesium, you've got to be taking your calcium. I would recommend D3 as well. And then K2 is important. It's a cheap supplement that's important to help get the calcium out of your blood and into your bones, because there can be bone loss with this drug as well. So on and on it goes with these side effects that are not like really rare side effects. They happen to a lot of people, not everybody, but a lot of people. Migraines or headaches are another huge problem, very, very common for a lot of people. Now, I have already dealt with migraines in my life, but they're definitely drastically increased on this medication. They happen for reasons that I couldn't even explain, like sometimes air pressure and that sort of thing can be a factor, but sometimes when it's not, I'm still getting migraines because that's what it does to you. Blurred vision or double vision is also a common side effect, which I have to a point where I've been given prisms to help with my distance vision. And that's a pretty big deal. And I am hoping once I'm off this drug that will settle. Now, because I have MS, I did have double vision years ago as one of my relapses. So it's probably sort of piggybacking on that. There might be some issue with a bit of a weak muscle that it's kind of taking advantage of. So again, I'm hoping that goes away, but it might not. That might be permanent damage done to me, and we'll see what happens in the coming months and years. For me, especially when I started this drug, and then for months after when I was on my highest dose, which was 150 milligrams a day, I would have weird feelings all through the day, weird flashback memories and feelings from my childhood mostly. And most of them were not exactly unpleasant, but it was just strange to be hit with them all the time. And especially because I've had seizures and I did have aura for one seizure and maybe an aura for the second one. They always make me think, am I having an aura? Am I having an aura? So there's that stress level of constantly all through the day. What is this? Am I having a seizure? And then I'm not. Or even when something feels familiar, I think I might be having deja vu, but I'm not. So it's a scary thing when you have even a couple of seizures that affects your whole life. But this drug seems to compound that, which I find very frustrating personally. Another one that is probably less common but does happen is something called myoclonic jerks or hypnic jerks, and I get those. Most people get them a little bit, sometimes occasionally when you're falling asleep, whether for a nap or at night, and you get one little quick, movement that wakes you up. And it's just any muscle in the body that can do it. And every now and again, that's not a big deal. But when you have it ongoing, hour after hour, it happens maybe every 10 minutes or every 20 minutes or every hour or whatever. When you have that happening all night, it is extremely disruptive to your sleep. And that's what I've experienced, to a point where it has just been frustrating. And I do experience them in the day as well. But it's not a big deal in the day because they don't hurt or anything. And it's not a super huge jerk. It's just like a quick little muscle twitch. So again, this is another one that could end up being permanent for me, but I am hoping and praying it's not, because it's awful and it's horrible for sleep. And I also noticed that when I have overdone it, when I push myself even a little bit too far, then my fatigue levels get a whole lot worse and the jerks come back much more as well. So I know if I've pushed it too much that day, probably that night I'm gonna have a rough night because of the jerks. And also for me, I also get these blasts of adrenaline sometimes. And that's especially true for the withdrawal part of the situation. So I'll talk a little bit more about that in withdrawal. So let's get into withdrawal. I had no idea. There is a lot of trouble with withdrawal from this drug. You can't just quit taking it, and you can't even just slowly wean off over the course of several weeks. Now, some people can, but most people, I think, really can't go that fast, because it can cause rebound problems that could be potentially permanent or at least last for several years, which is really scary because it's affecting your central nervous system, which is what this drug does. It just bleeds into every aspect of your life and your body and your mind, really. So I've read a number of stories of people quitting cold turkey, and occasionally you see someone who says, yeah, it wasn't too bad for me. I maybe had like a couple of weeks of difficulty, but then it settled down and I've been fine since. And that's great. And I'm hoping that would be my case if I have to quit cold turkey. If you have Stevens-Johnson syndrome, you do have to quit cold turkey and just deal with the fallout. So as I mentioned before, I don't have that, thankfully, so far. Hopefully I will not get it, and I can slowly keep weaning off. Even regular tapering can cause problems for people, and that's been the case for me too. I have tapered off down to a little less than 100 milligrams a day at this point, and hoping to continue. There is some recommendation from a lot of neurologists that you drop down by 20 milligrams each time you taper, probably once a month or once every 2 weeks is what they suggest. And a lot of people would say that is way too fast. You need to go down by, what's recommended is 10% of your current dose, and then 10% of your next dose, and probably over the course of just once a month, dropping by that. So that can get you to, even for my very low dose, that could take many, many months, and that's what I'm looking at right now. So initially I was instructed by my doctor to drop down by 25 milligrams a month, and I did start doing that. And I had huge withdrawal problems for about a week or so after each. And then I actually started to feel better than I had before. So it was kind of do the taper and then feel really awful for a little while and then start to feel much better. So a lot of the things did sort of largely resolve themselves, like the bruxism and basically all the mouth problems, and fatigue started to improve a little bit, and memory started to improve a little bit. So there are certain things that were starting to get better, other things not. Fatigue is not gone. The vivid dreams continue. The weird feelings still come and go. There's the acne hasn't gone. There's things that are ongoing that I'm hoping as I continue to taper will slowly dissipate. But there's also the concern, I think, wow, I'm so close to the finish line the more I go. But then it's like, well, now you should actually taper less and less. So instead of it taking a few months, now it could be by the end of the year maybe that I could be done, depending on how quickly I can keep going, because you don't want to push it. If you push it too hard, your central nervous system kind of freaks out, and any number of things can happen from that. And as I didn't mention before, if you do go cold turkey or drastically, quickly reduce your amount, you could end up having a seizure. And that's not just people who have seizures, that's anybody on this drug. It can actually cause you to have a seizure or seizures, which is crazy for an anti-seizure drug, in my opinion. No anti-seizure drug should potentially cause you to have seizures, but that's how it works. It's a drug. Now, from what I've seen, just in reading testimonials and ongoing stories from people and struggles and questions that they have and that sort of thing, it seems to be that people who take it for bipolar and related disorders have a harder time tapering off than people who have been put on it for seizures. I can't say 100% that's the case, but it seems to be that's how it works. And because I've been put on it for seizures, I'm hoping that it doesn't get worse as I taper, at least as it has for some. I know especially people who are taking it for bipolar and that sort of thing, as they wean off, they can find that they have sort of this disassociation, sort of a disconnection from the world, lack of feelings for anything. I have not experienced that, thankfully, but I have to keep an eye out for it because it could happen any time along the way. Even people who get down to 25 milligrams a day, just tapering off of that can cause some pretty serious problems. So I'm still learning as I go, but ultimately I have learned a lot from just going on social media and talking with just countless people, reading their stories of what it was like for them to get off of this drug, and also what it's been like for them to be on this drug, which is why they're now getting off of it, because it has so many side effects. It's terrible for you. So if you don't need it, and even if you have bipolar, I think there are other ways to handle bipolar other than taking a really harmful medication. I think there's a lot of help, support, natural treatments and things that you can do that I have read from these same people that you can do. You can at least try other things to help yourself. I do know there are people with bipolar who find this such a huge life changer that they're willing to put up with the side effects, and that's their choice, and I hope that it doesn't cause problems. Other people, maybe they've been on it for 10 years or something, and then things start to fall apart, and then they have to quit, and it's going to take them years to get off of it potentially if they do it properly. So it's a pretty serious thing. And for some of you on my channel, one of my videos in particular, we're saying that I'm all into the whole medical system and I'm all about drugs and I'm not about doing the natural route. Well, here's an example of yet another drug of multiple that have done serious damage to me, potentially permanent damage, hopefully not. So I know that the majority of drugs out there are really there for the money, and they're probably not going to help you that much, and the doctors will not tell you how much damage they're going to do to you. So I don't trust the medical system. I don't trust the doctors at this point, mostly. There are some that I can kind of trust if I feel like I can put my faith in them, if I see examples of them doing things that show they actually care and actually want me to be well, which is not that common, unfortunately. Other than that, I don't. I do my own research, and that's all I can do. And I have to find trial and error for me and for everyone who's taking these horrible drugs. Most of all, I would say, if you can avoid it, do. And if you can't, be aware of what's happening. Figure out how to take care of yourself. Try to get help from people who understand what it is to go through this, what it's doing to your body, and try to deal with these symptoms as well as you can, and also recognize when it's time to quit. I know a lot of people, both on Keppra and Lamotrigine, have gone for years not realizing how it was affecting their moods, and then realizing, wow, I'm not that horrible a person. I need to get off of this stuff and go back to what I used to be. So that's just a lot to think about, and I just wanted to share all of that. These are not all the side effects, either from the drug itself or from withdrawal. So I hope it gives you a general overview, but if you are looking at doing this drug, or if you've been on it a long time, please do your research. Look into what this drug does to you. So thank you for watching. I hope this was helpful to you. Of course, the usual, if you like this kind of thing, please feel free to like and subscribe and share with your friends. And God bless.